As we are fast approaching the FDA shutting down availability of the compounded GLP-1 agonist medications in the United States, thousands of people across the country will once again feel the terrible effects of something called financial toxicity in medicine. In this video, I'll break down what GLP-1 agonists are, how they work, the financial challenges people face with these medications, and finally, possible solutions and resources and strategies that might help make these treatments more accessible to you. Welcome back to the channel. My name is Dr. Gerard Acloque, or better known as Dr. G, and I'm an internal medicine physician in Hollywood, Florida. I'm also a lifestyle modification coach and patient education advocate. Today, we're diving into a topic that impacts millions of Americans, the financial toxicity surrounding GLP-1 agonist medications for the treatment of obesity in the United States. If you're new to the channel, GLP-1 agonists like Ozempic, Wegovy, Zepbound, and Mounjaro have gained a lot of attention in the last several years as promising options for weight loss and obesity management. While these medications can be transformative for those struggling with obesity, the high costs associated with them create a significant barrier to access, especially now that the manufacturers have seemingly figured out their supply chain issues and here in the US, and the FDA is reportedly near to making a ruling forcing compounding pharmacies to stop producing compounded versions of the GLP-1s, which are much less expensive versions of the medications. In other words, the brand name medications are just way too damned expensive for many people to afford consistently. This will potentially cause interruptions in care, or care won't be continued at all for many thousands of Americans. So what are GLP-1 agonists? Let's start by reviewing once again what GLP-1 agonists are, just in case you are new to my channel. These medications are a class of drugs initially developed for the treatment of diabetes, but research found that over time, they can significantly aid in weight loss as well. Essentially, GLP-1 agonists work by mimicking a hormone in the gut that helps control blood sugar, reduces appetite, and slows down digestion, leading to a lower calorie intake and, for many people, substantial weight loss. For anyone dealing with obesity and struggling to lose weight, GLP-1 agonist medications can offer real hope, actually, and they address the biological factors that can make losing weight so hard for so many people. But hope can be hard to sustain if the price tag keeps it out of reach. If you want to know more about the medications, I'll put some of the links of some of my videos in the description below, giving expert guidance on the use of GLP-1 agonist medications for weight loss. So let's get a good understanding of what financial toxicity is. When we talk about financial toxicity, we mean the economic burden that individuals experience due to the high cost of healthcare. Costs that can lead them to long-term financial stress, difficult trade-offs, or even the decision to forego treatment altogether, which can be tragic. For many people, this financial strain can lead to serious consequences like debt, stress, and worsening of health outcomes. So let's break down some of the numbers. Currently, a single month supply of GLP-1 agonists can cost in the United States upwards of $1,000 to $1,300 if you're paying out of pocket. Now, most people would agree that's a staggering amount of money for a monthly medication. Insurance may help some people, but even then, coverage can be inconsistent, and copays for deductibles can still add up. Even with the assistance programs that are out there, the cost can be as high as $350 to $600 a month, which for many Americans struggling with the effect of obesity is a very high number. Thankfully, at least some patients with diabetes may find better insurance coverage for GLP-1s, and these patients using these medications primarily for weight loss and the complications associated with obesity may often face more challenges getting covered, as many insurers still view obesity treatment as cosmetic or non-essential and not an actual disease, which is a shame. It's not true. So we're left with a situation where some of the people who need these medications most, the ones whom obesity poses serious health risks, can't afford them or have to make extreme sacrifices to afford them. And this is a classic example of financial toxicity. And for many, it leads to very tough choices like maxing out credit cards, delaying other essential care, or even skipping the medication entirely and suffering many times deadly consequences from a health care standpoint. So finally, let's move on to the impact of financial toxicity on physical and mental health. For someone who's motivated to make a change and sees the positive effect of these medications, the inability to continue treatment can be devastating. It's not just about the physical progress they might lose, it's about the emotional impact of feeling like a solution was just in reach, but not affordable to them and not for the long term. And also the psychological impact of falling short on another weight loss attempt is terrible and can be life-changing for them as well. So not to mention the financial strain itself can worsen overall health. Stress is a known contributor to obesity and other chronic conditions. So the irony here is that the GLP-1 agonists can help improve health, but the financial stress surrounding their affordability themselves can also undermine the very benefits people are trying to achieve. Now, here's where things get a little more hopeful, because I don't want you to leave this video thinking there's no way to solve this issue. In fact, the real reason I'm making this video is to discuss navigating options and seeking solutions. While the system is far from perfect, there are some strategies and resources that can potentially help reduce the burden. Insurance appeals. Some patients have found success by going through an insurance appeal process, sometimes taking it to a second appeal. And this often involves having your doctor advocate on your behalf, explaining the medical necessity of the medications, and can be a hassle, but it might be worth it if you're able to get partial or full coverage. Currently, we are doing this in my office for every patient who medically needs or meets criteria for the treatment. And I'll be honest, it's very frustrating to receive so many denials when you know the patient needs a medication and my staff knows what the outcome will be most of the times, but we live for those notifications of approval and celebrate with our patients when they actually do happen. There are some pharmaceutical assistance programs, and many drug manufacturers offer patient assistance programs. And while not everyone will qualify, these programs may provide discounted or even free medication to people who meet specific income requirements. So ask your provider or their staff if the medication you are on or being prescribed has an active assistance program. Many of the more expensive medications do, and you may qualify, and it never hurts to ask or to try. There are some coupon programs and online discounts. So various online platforms provide discount cards or coupons for certain medications. Though their discounts may vary, every little bit can help. Maybe you should consider telemedicine and weight loss clinics. Some telemedicine platforms specialize in weight loss prescriptions and may have better rates for branded GLP-1 medications due to their partnerships. And it's worth exploring if these services might offer a financial benefit to you. Legislative advocacy is huge. On a bigger scale, we need to advocate for legislative changes that would require more insurance companies to cover obesity treatments. And by we, I mean everyone. Not just doctors and not just patients, but everybody. Obesity is a recognized medical condition with real health risks, and access to effective treatment should be considered essential. Obesity affects 40% of the Americans directly and so many more indirectly, both financially and socially. So contacting your local representatives and supporting policies that improve access to obesity care is an important step we can all take. So some final thoughts and some encouragement before you go. I want to leave you all with this thought. Financial toxicity should not be the reason people miss out on life-changing treatments. Obesity is a complex chronic condition, and it deserves the same respect and support as other health issues. You deserve access to effective, affordable treatment options. If you're currently facing financial toxicity with GLP-1 agonists or other medications, know that you are not alone. I encourage you to explore the resources we've talked about today, speak with your healthcare provider, and if possible, connect with support groups or advocacy organizations working to make obesity treatment more accessible. I'd like to thank you for watching this video today, and if you found this episode helpful, please like and share it with your friends and your family who might benefit from the information in the video. It will really go a long way to helping get this important message out and helping this channel to continue to grow. Don't forget to subscribe for more insights on the power of lifestyle modifications and information to empower you to make better decisions and informed medical decisions. And remember, real change starts with awareness and advocacy. Let's work together to push for affordable healthcare options that truly serve everyone. Check out the description below for a special offer on my online lifestyle modification community, which has grown to about 20 members in a little over a week. There, you can get direct access to myself and now my certified coaches and more for free, just for 48 hours free on the offer in the description below. So until the next time, please stay informed and stay healthy. I will see you soon.